after prostate brachytherapy, men often ask when will they be able to return to their normal activities. And I advise them that it can vary, but I definitely have a good number of patients who are able to go back to work within a few days.
Prior to the event of brachytherapy, we spend a lot of time in education. Our nurses spend time preparing a guy, I spend time telling him what to expect, but the actual event of brachytherapy is an outpatient procedure. In fact, it's only an hour or so, and then we prepare the guy to go home.
Takes about an hour to do the case. You then go back to the recovery room.
Once you wake up, we do imaging, usually an MRI, and you go home, and I don't really put any limitations on guys.
Patients can go back to their normal work routine after about 1 day.
In terms of activity, I generally tell people take it easy that day and the next day, and after that, back to regular activities. Exercise, work, play, all can be done certainly within a few days after you've completed your treatment.
I do usually recommend that patients don't do heavy physical activity for a week or two, just to be extra sure that the seeds are all locked in place. But in terms of going out to dinner or doing a regular kind of office sort of job, there's no restrictions after a day.
That day, because you've had anesthesia, I really would recommend that you take that day off. I also ask if they can to take the next day off, but they can do their normal routine at home. A lot of them will go back to work the next day and they feel very good. So this is the specific benefit that I think is something that patients need to understand when they're looking at this procedure. Your quality of life of getting back to normal is so excellent with prostate brachytherapy that it is a treatment strategy that you just cannot ignore, because you get the job done without a catheter in most all cases, as well as getting back to the normal routine.